Welcome to RISE's Bite Prevention and Response Training for Behavior Technicians. Biting can occur in some individuals receiving ABA services. Our goal is to prevent biting by recognizing early warning signs and teaching safer communication. Staff safety and client dignity are both important priorities. We have a lot to say, so here's an agenda of what we will learn. 1. Introduction. Welcome to RISE's Bite Prevention Training for Behavior Technicians. Biting can occur in some individuals receiving ABA services. Our goal is to prevent biting by recognizing early warning signs and teaching safer communication. Staff safety and client dignity are both important priorities. It is important to understand why biting happens. Biting is maintained by one of four behavioral functions: escape from demands, access to attention, access to preferred items, sensory stimulation. Understanding the reason for biting helps us teach appropriate alternatives. What is your client trying to get or get out of? Learn to read the early warning signs. Many clients show warning signs before biting called precursors. Precursors are a behavioral change you notice in the client. Common precursors include jaw clenching, teeth grinding, staring at arms or shoulders, grabbing clothing, moving quickly towards staff. When staff recognize these signs early, they can prevent escalation. Your intervention should start at the point of precursors. Learn how to use safe body positioning. Safe body positioning greatly reduces bite risk. Safe positioning includes standing at an angle instead of directly in front, maintaining arm-length distance, keeping hands away from the client's mouth, avoiding leaning over the client. Pay attention to always keeping your hands, arms, and body away from where the client could simply lean forward or turn their head and do a quick direct strike. Keep your body out of the path. Never turn your back on a client. Distance and positioning help prevent bites. Implement prevention strategies. Staff should use proactive strategies, including providing frequent reinforcement, offering choices, prompting communication, reducing task difficulty during escalation. It is acceptable to ask a parent or caregiver to sit in to be able to step in for safety during your session. RISE staff cannot restrain or discipline a client. Wear protective gear, such as bite gloves. You might additionally wrap gauge bandage around your arms or hands. Wear long sleeves. If a client becomes frustrated, prompt them to request a break or ask for help. Know your client's intervention plan and properly respond to bite attempts. If a client attempts to bite, move your body out of range. Increase distance. Stay calm and neutral. Redirect the client to a replacement behavior. Implement your behavior intervention plan. BIP. Use simple language such as safe mouth. Here's what you should do if a bite occurs. If a bite occurs, remain calm. Do not yank your arm away. Create space once safe. Keep your facial expressions neutral. Do not accidentally deliver social reinforcement. Keep your voice tone calm and direct. In lower tone again, no social reinforcement. How to release a bite. Do not yank your arm or body part away. Instead, you should push into the bite. Put your hand on the back of the client's head and push their head toward the bite. You want to prevent them from pulling away because the greatest damage can occur as they pull a bite out. Autistic clients typically feel compelled to routine. You might start then abruptly stop a phrase you know they will feel compelled to open their mouth to finish. For example, if your client likes to sing Old MacDonald, you might sing, "Old MacDonald had a farm." E-I-E-I-E. When you abruptly stop and don't finish it, they may open their mouth and release to say, "Oh." After release, assess for injury. Notify other people at the site and ask for assistance. Notify your supervisor. Seek medical attention if you sustain injury. Complete all required documentation. In non-emotional language, include in your progress note the details of the actions that occurred and state what actions you took to address the behavior which should match the client's prescribed intervention. Fill out an incident report. Make sure to state in that report what actions you will take in the future to prevent a recurrence. Fill out workman's compensation paperwork after your medical visit and send it to Forms email to your supervisor. You can find the paperwork and our workman's comp policy in our handbook on our website on the Useful Links page. Our website is www.riseautismcenter.com. Always remember to reinforce your client's safe behaviors. Reinforcing increases the behaviors we desire. Always reinforce appropriate behavior. Provide praise and reinforcement when the client maintains safe distance, communicates appropriately, requests a break instead of engaging in problem behavior. Reinforcement strengthens safe alternatives. Remember the key steps for bite prevention. Recognize early warning signs precursors. Maintain safe body positioning. Use prevention strategies, including implementing the Behavior Intervention Plan, BIP, when attempts occur. Do not pull away if a bite occurs, push into it. Stay neutral and calm if a bite occurs. Use bite release strategies. Prompt communication to other present parties and your supervisor. Seek medical attention immediately if injury occurs.